Do you have a friend with premature ejaculation? I guess your friend would like to know which options of treatment he has. In this video we will discuss which options of treatment we have to treat your friend with premature ejaculation. But the first thing we would like to tell is that if we get the right diagnosis, it's much more likely that we'll have the best and fast treatment for your friend with premature ejaculation. So don't hesitate to go to your health professional if you have any doubt. So let's begin. We have 5 options, 5 strategies to treat premature ejaculation. The first of them would be the physical method. What's a physical method? Well, for example, a condom would be a physical barrier that would rest us sensitivity, so our penis would have less sensitivity and thus we will have a longer intercourse, longer sex. The second strategy would be gel or a cream with local anesthetic, such as prelocaine or tetracaine, etc. We know that this local anesthetic will produce some degree of numbness in our penis, and thus we'll have, again, longer intercourse. From a commercial standpoint, we know that there are options such as condoms with anesthetics that are available in the pharmacies all around, so you can have this, you can try on these condoms and try to see if that works for you. The third of the strategies would be drugs. I would like to recommend mainly 2 kinds of drugs. One would be some kind of antidepressant drugs such as clomipramine or fluoxetine or paroxetine are very well known drugs that improve the duration of sex. We have been using them for 30 or 40 years, and they work pretty well, but there's mainly one problem with that. We should be taking these drugs 3 or 5 hours prior to sex. And I guess few of your friends are available to guess if they'll have sex in 3 or 4 hours. So it's difficult. The second option would be to daily take it. But the problem is that we do not know the effect of an antidepressant drug in a normal person taken daily. So it has not been, these kind of drugs have not been accepted for use, and daily now they are used off-label. So we do not recommend you to daily basis take these kind of drugs. The drug that has been proved to be safe and effective and that has been approved for in mainly countries to be treating patients with premature ejaculation is dapagliflozin. Dapagliflozin is an ISRS that it lasts 1 hour from the intake to the beginning of action. Dapagliflozin multiplies per 3 the duration of sex, and their secondary effects are mild in nature, mainly headache or nausea, etc. But it's quite a pretty good tolerated and safe and effective drug. The fourth of the strategies would be sex therapy. Sex therapy, it's very remarkable. It's one of the most important single treatment for premature ejaculation. Most patients with premature ejaculation will go better just with sexual therapy. We have to be constant. Maybe it doesn't work the best way the first day, but it will go better day by day. So I really counsel you to keep doing sex therapy and your premature ejaculation and your friend's premature ejaculation will go better. How to do that? It's very easy. It's a system, it's called start and stop. It comes from Masters and Johnson studies from the 60s and the 70s, and mainly deals with, you begin with the intercourse, you begin with sex, and when you feel that you're about to climax, to arrive to the orgasm, you stop, and when the sensation goes down, then you begin again. So that's why it's called start and stop technique. And as I was saying, it's a very important technique. It works really very well. If you're constant with that, in some months you'll feel that your premature ejaculation is getting better. The fifth strategy would be KEGEL exercise. Pelvic floor muscle rehabilitation has been proven to be very effective in some areas of medicine, gynecology, urology, and in the last years we have been proving it in sexual diseases such as erectile dysfunction or premature ejaculation. How to do pelvic floor muscle rehabilitation? We'll do a special video about that, but just to summarize, we should create a contraction in our pelvic floor muscle. And how to do that? Well, imagine that you're peeing and you want to cut the stream, then you get your contraction in your pelvic floor muscle. So that's the way to do it. If we do it several times per day, our control over ejaculation will improve. So, to summarize, we have mainly 5 strategies to improve premature ejaculation. Physical methods such as a condom, gels with anesthetic. The third would be drugs, mainly dapoxetine. The fourth would be sex therapy. And the fifth would be KEGEL maneuver. I hope this video was helpful for you. I want to underline again that if you have a problem, you should be going to the specialist. If you get a proper diagnosis, you'll get a much faster, safe and effective treatment. Again, I hope this video was useful. Thank you very much. Let's see it.